The three types of angina. Recall that angina is the pain felt when blood flow to the heart is inadequate. It is ischemic pain. And there's three specific types of angina. There is chronic stable angina, there's unstable angina, and then there's variant angina, which is sometimes called Prinzmetal's angina. Remember, the word angina comes from the Greek word, which means something like to strangle. This strangling is the common thread in all three types of angina. Again, in all three types, the patient feels some sort of chest pain, like their heart is being strangled. And sometimes this pain can radiate to the arms and jaw. So the first type is chronic stable angina. And chronic means recurring over a period of time, usually measured in months or years. Stable refers to the type of plaque. And angina because it's ischemic pain in the heart. Chest pain, if you will. Stable angina is also called effort angina. The reason why is because effort refers to physical exertion, physical effort. Chronic stable angina, or effort angina, is the pain felt from inadequate perfusion to the heart during some kind of physical exertion. So the word stable does not mean good, it just means like something like predictable. So there's angina, there's chest pain, which is secondary to cardiac ischemia. It's likely to occur during physical exertion, and it's likely to alleviate with nitroglycerin and or relaxation. So a patient with chronic stable angina will have chest pain. It's commonly, the classic story is someone walking, especially walking into the cold, and when they're starting to get their heart rate up, their heart's demanding more oxygen, which means it needs more blood. And if there's a stable plaque there, then it's not going to be able to receive as much blood as it needs. The second type, these are the causes of stable angina. Again, I had already alluded to it, but most likely a patient's chronic stable angina is going to be caused by plaque obstruction in the artery. And then the subsequent pain occurs when blood flow is diminished from the plaque, right? So you have these vessels, and remember, the heart itself needs blood, and when cardiac workload's increased, then the heart needs more blood, and it's more important that the heart gets blood because it's a tissue that's very vulnerable to death. So unstable angina. So now that you know about stable angina, you might have guessed that there is an unstable angina, and you probably guessed what that is. Unstable angina is unstable in that it is not easy to predict. Moreover, it's a worse sign. So these pains are more unpredictable because plaque buildups are now exceeding 75% of the lumen's diameter. So it's a worse sign. And these pains are more unpredictable. Stable plaques will grow, right? So if you have stable angina, if it's untreated and dietary lifestyle changes aren't adhered to or prescribed, the plaque is most likely going to get worse, and that turns into an unstable plaque. And there's a few other problems with that. But again, remember, the common thread is that so much blood is restricted to the heart that ischemic chest pains, also known as angina, can occur. But now in unstable angina, this can occur even at rest, right? So this is a worse sign, and it has a worse prognosis or outcome. Whereas in stable angina, it was predictable. This pain would occur during physical exertion, and it would alleviate with both rest and the use of something like nitroglycerin. And once there's a full or nearly full occlusion of the lumen of an important artery, which would be one that would be supplying the heart, all of the coronary arteries are important, well, then you'll have a myocardial infarction, which is also known as a heart attack. And we're going to cover that separately. But again, heart attack is when it's not getting enough blood, and that would be very common in something like a plaque buildup. And when you have an unstable plaque where the lumen is, only a quarter of available, then you're leaving the heart prone to long-term ischemia, which would lead to myocardial death. But we're going to talk about that later. The final form of angina is called variant angina, also known as Prinzmetal's angina. And the little mnemonic is that the V in variant can remind you this is due to a vasospasm. It's due not to this is a non-atherosclerotic plaque. A non-atherosclerotic angina. It's not due to any plaques. It's due to the inappropriate constriction or spasm of an artery. Sometimes the patient will be complaining, they're going to come in complaining of chest pain, and the doctor's going to look at the patient's arteries because they want to see if the angina is coming from like plaque buildup. And then they'll get a look at the arteries and see that they're totally clean. And then they might start suspecting variant angina, which is caused by inappropriate vasospasm. And this type of angina is a little bit more unpredictable, and it's going to have a different treatment than angina, unstable and stable angina, which are caused by atherosclerotic plaques. So the nursing implications of angina, so with angina, there can be activity intolerance due to ischemia, though, again, Prinzmetal's angina is not so easy to predict. And it's not as common either. And it's actually, I think, most common in young women. So as with atherosclerosis, your angina patient might be dwelling on potential heart attacks or strokes from ruptured plaques or plaques that induce inappropriate blood clots, or they just might be anxious about their pain. And as I say, I say this frequently, but patients with a scary prognosis are either going to be concerned, they're going to be like anxious, or they're going to be unconcerned, and sometimes they're going to be somewhere in between. So remember that plaques have sometimes been known to regress with strict dietary and lifestyle changes and effective use of pharmaceutical agents like statins, but also pain could be relieved with nitroglycerin. So it's important to give a realistic outcome to your patient. For instance, there are things your patient can do. It's not going to be easy, but there's things they can do. So you have to remember that the majority of patients are not going to adhere to strict changes, like even smoking cessation is a difficult one, but even more difficult is diet and lifestyle improvements, or adherence to prescriptions, especially with elderly patients. So your patient may be very anxious about possible outcomes, and likewise they already have a plaque buildup, which is advanced to the point of causing them chest pain due to ischemia. So it's imperative that they know the magnitude of their decision to change lifestyle and diet and consistently take their prescribed medications. As always, these are sensitive and often vulnerable moments for your patients, so it's important that your disposition and your mannerisms are positive, so you can help the likelihood of your patient following their given lifestyle and pharmaceutical regime. So I included, again, this study that it's just an interesting little read about the regression of atherosclerotic plaques along with the prevention. But these emerging treatments, I just thought this would be some interesting food for thought here. So I'll see you in the next lecture.